We are pleased by the hard work, teamwork, and commitment to offer quality patient-centered care for all of us. So CS, we are in the process of recruiting more staff, and we thank your ministry for the continued support to achieve our commitment to deliver quality patient-centered care in this institution. So we thank you for continued support and welcome to this institution. Thank you.
Thank you. Thank you very much, Madam Chair. I am delighted to be here, fellow Kenyans, today at this state-of-the-art facility, the Kenya University Teaching, Referral, and Research Hospital. I'm here today to officially open the Infectious Disease Unit, IDU, as well as the Intensive Care Unit, ICU. And this institution is truly the pride of a nation. In this facility, we have got 1,000, we had originally 650 beds. And indeed, those 650 beds, 150 we are using for the cancer and other issues, and then some 500 beds in different systems were put together when COVID came in March of this year. You will remember that after Bagathi, this was the second institution that we came to look for quarantine and isolation facilities. And at that time, if you remember, we had 8 infectious disease beds, out of which we have grown to thousands of them. I'm grateful for the warm welcome by the board of the hospital, led by Professor Olive Mogenda. Today, as a result of the effort that has been made by that board, we will have an additional 500-bed facility, out of which 60 of the beds will be HDU and ICU. And today, we have to start that process. We have already installed some 30 beds, and we are glad to say that as opposed to popular opinion, that the health sector in this country has been overwhelmed, even the original 24 that we had put in place are still not fully occupied. So it is not true to say that we had been overwhelmed. Nonetheless, it is better to be ready in advance than to be rushing if the facility were to be so overwhelmed. So with the support of the Kenya government and working together with this facility, this hospital, we will now have 60 additional HDU and ICU beds, as well as 440 isolation beds. That means that in total, this facility will now carry 1,150 beds, out of which 150 will be for cancer purposes, and then the rest of it really committed to COVID-19. And I would also like to echo the thanks of the support we have had from people in and out of the Republic. I would particularly like to recognize the presence of the Cuban friends, the Cuban doctors who are here with us today, and to say that you are among friends. Your colleagues, as you know, have been here for a while now, and we don't think of the doctors as foreigners. We like to think of them as family. And I have no doubt that you will also be in the same form and place. This is one of our newest teaching and referral facility in the country, and we are extremely proud of it. We had hoped to officially open this facility in early March, but that was not the case. This is because, as you all know, that's when COVID-19 pandemic struck our country. We immediately had to re-strategize. We started thinking of turning this into an isolation facility and tasked the board to make the model work. I am so happy the board took up the challenge and did what they had to do. For this, I thank you, Madam Chair, and your team. Thank you very much indeed. On the other hand, as we are all aware, oxygen is a very important part in the fight against COVID-19. I'm glad to note that this facility has an oxygen plant that is piped to all the clinical areas and is able to refuel to other facilities within and out of this institution. It is worthy to note that the progress here is not isolated. In all other facilities managed by the national government, there has been tremendous improvement. The same achievement has been witnessed across our counties. I have been impressed by what I have seen in the few counties that I have visited, and that we are getting from other counties is impressive. And indeed, my ministry will continue to visit and work with other counties. Beginning this Friday, there will be a Western and Nyanza circuit by my ministry just to see and to discuss what we can do in capacity building in the counties. So far, Nairobi accounts for 60% of all COVID-19 positive cases. And as we have said before, Nairobi is at a critical stage in the growth of the pandemic and requires increased capacity to cope with the situation, and hence why we are here. Fellow Kenyans, as you may be aware, COVID-19 is a disease that has taken us and the world by storm. Today, we worry about ourselves, we worry about our relatives, and we worry about our friends. As a people, we are together in this struggle, hand in hand, for our fate is intertwined. For many weeks, we have emphasized the need for everyone to take individual responsibility and trying to be as safe as possible from the virus. When you wear your face masks, you not only save yourself from the disease, but you also prevent others from catching it. But above all, you also slow the spread of the disease so that our healthcare system is not overloaded. Slowing the curve is still very vital to us. Therefore, I want to thank every Kenyan who is strictly adhering to the containment measures we have advised. You are heroes, and you are really saving lives. Today, I think just about every Kenyan can tell you of a friend, the friend of a friend, a relative who has already either been isolated because of testing positive, or indeed, sadly, some who have passed away. Nonetheless, there are still those who feel that is a distant disease, who do not want to adhere to what we are saying, and instead turn to the usual moaning and groaning and blaming the government for all and sundry. I'm afraid the government can't get sick. I can. You can. It's not a government issue. It's an individual issue. It's an individual responsibility. And I'm glad to say that most Kenyans know what they are doing and have taken to wearing masks, some of them homemade, others bought, but nonetheless, they are obeying the law. As you also know, we have lost 2 healthcare workers to COVID-19. This is like losing a soldier in the middle of a battle. Therefore, we need to keep our medical personnel as safe as possible. Besides providing them with protective gear, we have also continually addressed their welfare needs. We note some mamas among some of the workers, and we would like to address those mamas as well. In this regard, it is important to note that service delivery remains a county government function, and urge all county governments to listen to any complaints, murmurs, or concerns among our healthcare workers with a view of addressing them in the soonest possible time. As a ministry, we stand ready to extend our support as may be necessary to ensure that our people are served across the country. Further, we recognize the need to hire more health workers and personnel in this field And I'm glad to hear, Madam Chair, that that is indeed what you are preparing to do in this institution. We have increased the funding to county governments to do exactly that. And it's our hope and expectation that where there are shortfalls, they will be addressed as soon as possible. It might be recalled that when we confirmed the first case, many other countries around the world were doing the same. Some were already in the middle of their worst situation, and the global demand for PPEs was huge. We got into the market at a time when this demand was extremely high. But because we had an emergency, we had to contend with the situation as it was. Price is largely controlled by demand and supply schedules. But while we worked on this situation, we started addressing our local capacity for the production of PPEs to make sure that we were not subjected to prices that were not cost-effective to our service delivery. Consequently, we challenged our local manufacturers to develop PPEs, and I'm glad to note that they stepped up to the challenge, and we are now producing our own local and even exporting some. Aware of the need to allow for competition in the supply of these essential commodities, the ministry sought a waiver for the counties to acquire PPEs from different suppliers and not just from KEMSA. This way, we expected, and it still remains our expectation, that counties would get best value for their money and for public money. We continue to urge prudence in the acquisition of these PPEs and indeed all health commodities to ensure that we deliver value to our people. And I wanted to make those remarks because obviously there has been press reports about the prices that were there before for PPEs, the prices that were there for face masks, but I would like to say that anybody doing a little research will find that that indeed was the situation across the world at that time. On our COVID-19 statistics today, some 671 people have tested positive from a sample size of 6,200 in the last 24 hours. That means that today, Kenya has 23,873 positive cases. Our cumulative tests now stand at 329,123. 633 of those people are Kenyans, while 38 are foreigners. 413 are male, while 258 are female. The youngest is a 3-year-old baby, while the oldest is 94 years old. Nairobi continues to lead with some 376 people. Kiambu now takes the second position at 112 positive cases. Machakos at 20, Kisumu at 16. You'll be happy to know that Mombasa continues on a downward curve, reporting 6 cases today. The details of the other figures are here with us, but it is good to know that, for example, here in Nairobi, the 376 cases in Nairobi are in Dagoretti North. And that's a big number for one area, Dagoretti North. Langata, Langata has 37, Westlands has 34, Kibra has 25, Dagoretti North, has 42 out of the 376, and Kamukunji has 23, Kasarani has 23. So it is spread right across the town. I'm also delighted to inform you that 603 patients have recovered from the disease. And this is a good balance. If you notice the number of persons who have contacted and then the number of persons who have recovered, that sort of balance is good news to us, because it means that as the spaces are being vacated, then we can be able to bring in new cases without stretching our capacity. And that's what we've been trying to do, to bring the curve to such a manner that as people are getting better, it is possible for us to create space. The problem begins when the ones coming in so overwhelm the ones leaving that it is not possible to cope. So I'm delighted that some 436 are on the home-based program, and 167 have been discharged from various hospitals. That means that we have now some 9,930, and our congratulations once again go to our healthcare workers for the commendable job that they continue to do to this nation and service to God. Unfortunately, we have also lost 3 patients to the disease, bringing our fatality levels to 391. And our sincere condolences go to the families and friends of those who have lost their loved ones. Finally, let me take this opportunity to once again thank the management and board of this institution, together with the staff, for their selfless efforts to improve the quality of healthcare services in this facility, and indeed to urge that they continue to do that very good job that you are doing. We owe you, and we are grateful that you are part of us and part of our family. I can only assure you of my support and that of the ministry. May God bless you all. I would like to offer this opportunity for questions, clarifications on what we have said. Please, as usual, do the needful in terms of identifying yourself.
Good afternoon. My name is Purity Muse from KBC. My first question would be on how many people have come into contact with COVID-19 disease in terms of the people you're tracing from the 23,000 cases that we have so far. And number 2 would be on the kind of challenges that the ministry is facing with the home-based care program, because most patients are saying they are going even days without getting any communication from the healthcare providers who are supposed to be contacting them and providing support. And also retesting, it's also a challenge to the patients under the home-based care program. Whether you are aware of that and the more challenges you're facing with this program.
Elfas Lagat from Citizen TV. And Waziri, you mentioned that this facility here in KU would be incremental. You already mentioned that there are 30 beds in the ICU and that you intend to have 500 capacity. Do you have a timeline for this facility? And again, you had also divided counties into clusters, 11 clusters, and the last communication was that about 29% of the facilities that you had visited were considered highly prepared to handle COVID-19. What is the status as today? Thank you.
My name is Mutanu from the Daily Nation. I have one question. Maybe, Waziri, you can tell us the number of healthcare workers who have got infected with COVID-19 so far, and the total of those who have died from the disease. Thank you.
David Mudoka from TV47. There's a report of a family in Migori whose 48 members have contracted COVID-19, and that clearly depicts how community spread is gaining momentum in the country. Is that a worrying figure for the ministry now?
Okay, thank you. Thank you very much. I'm going to divide this and throw them into 2 directions. I would like to offer the opportunity for the timelines as far as the development of this institution and going forward to the chair of the board. And as for the health workers and home-based care, I am going to ask Dr. Amoth to deal with that particular one. And I deal with the issue of the 48 members of the Migori family who have contacted. My information regarding this particular situation is that somebody came from Nairobi and went to Migori and there started that whole thing within the family. In addition to that, I think we also had somebody who came from Nairobi, went to, I think, Siaya, with the mother to say hello to the mother, took the disease to the mother. He then brought the mother back to Nairobi to be treated. He died, unfortunately, and the mother is being treated. Now, why am I telling you this story? Mutani, who was it? Muthoka, you are the one who asked the question. Why am I telling you this story? I'm saying COVID-19 is real. We have said it since March. We have said it for a long time. We have told people that they will test their parents. We want them not to do it. Some have already. So the only thing we can do is to urge those who have not, please don't do so. If you were skeptical before, if you were not sure before, at least now you know for a fact that people, A, are dying, B, are getting infected, and the easiest way to destroy your parents is to go to them without masks, without caring, at their age, and knowing the statistics that we have been reading. That is what is likely to happen. Kwa hivyo, ni lazima jameni, ni lazima tuchunge wazazi wetu, ni lazima tuchunge familia zetu. Ukisikia ati iko familia moja ya watu 48 ambao familia moja iko COVID positive, hiyo ni kusema ya kwamba hii virusi imeenea kila pahali katika nchi yetu ya Kenya. Kwa hivyo ukiwa Migori, ukiwa Nyeri, ukiwa Marsabit, usije ukafikiria ati kwa sababu wewe uko kwako nyumbani ati hiyo virusi hapana iko hapo. Iko hapo na wewe. Na usijihadhari, usipojihadhari basi utaambukizwa na vile utaambukiza wale wengine ambao ni rafiki zako na wako katika hiyo familia. Sio hiyo tu peke yake Muthoka, ambayo sio familia hii tu peke yake ambao imeambukizwa, kama familia ikiwa yote. Familia sasa ni nyingi katika Kenya ambazo unaenda kwao utaambiwa mama ako nayo, mtoto ako nayo, hata grandchild wajukuu wako nayo, kila mtu amepata katika familia moja. Na vile tu ni Mungu anatuonea huruma kwa sababu tunaendelea kupona. Ni Mungu tu, tunashukuru Mungu na tunazidi kumuomba tusije tukaumia zaidi, kwa sababu jameni, hii virusi haiwezi kwenda peke yake. Ni watu wanaipeleka nyumbani, ni watu wanaipeleka kwa familia. Kwa hivyo tafadhalini jameni, tujikinge. You save me, I save you. You save your family member, the family member will save you. But unless we do so, iko shida. Madam Chair.
Thank you, CS. As you mentioned, CS, we have planned for 60 ICU/HDU beds. Today we have 30 that are ready, and the remaining 30 will be ready in 2 weeks. But also would like to add that out of the 24 beds that we have already for ICU, we have 15 with patients, so we still have a capacity of about 9 or 10 left. So as we do that, we will still keep adding the rest. In terms of the bed capacity for isolation, as the CS said, we had a capacity of 500, and we still have 200 of those beds left, so we still have a bit of capacity. And the rest of the 440 beds, we will be able to have them ready within a month. But meanwhile, we still have space for those who may need that space. Thank you.
I think it is important, Kenyans have got a sense of beating themselves up and sometimes not praising themselves. I think it is important for us to just appreciate what has happened in this institution. When you think about the fact that they have got this, they already had 24 beds. They are putting another 60 beds. That brings a total of 84 beds, 84 HDU and IDU beds in one institution. in only one institution. And that's not a small measure. And when you consider that they have got over 1,000, if you put all those things together, they have got over 1,000 beds. It becomes an extremely admirable institution. In this infectious disease unit alone, the one with the 500, it is a total of 500 beds. 60 of them, HDU, ICU. The other ones are regular isolation facilities. And I saw Kenyans circulating a video round. I think I said it the other day. I saw you people very excited circulating a video round about how Ghana has got a 100-bed capacity. And you are so excited and saying how great Ghana is. Please, Daktari.
Thank you, Waziri. Thank you, Chair. I'll answer Purity's question regarding contact tracing. On average, we have traced more than 75,000 contacts since the pandemic began. And contact tracing is a science where first you need to identify the contact, either based on a positive COVID-19 test or a presumptive diagnosis of COVID-19 test. Then you list the contact in what we call the line list. And then you do follow-up, which can be active or passive. Passive meaning you simply communicate the risks of COVID-19 disease. Active means you do a daily follow-up, either through a telephone call or a personal visitation. And finally, at the end of the contact tracing period of 14 days, then you do a discharge. So we have done well, but remember, the pandemic is in various phases in the country. Nairobi is reporting intense community transmission, and therefore that makes contact tracing technically very, very difficult. You don't give up on it altogether, but again, now you try to refocus and repurpose your resources so that you try to shield the very vulnerable and try to reduce the risk of mortality. So that is what we are doing. But a county like Marsabit or Samburu, which reported its first cases just yesterday at 8, you can be able to do intense contact tracing and stamp out the transmission. So we are developing different interventions based on the pattern of transmission of the disease across the country. Of course, contact tracing, home-based care, in terms of the second part of your question, home-based care is 9 times cheaper, as you have articulated before. Patients are at home, very familiar environment, and they tend to recover much faster. But it's also very intensive because somebody has to be able to visit them or make a follow-up telephone call every day to find out how they are doing. So counties which have established community health systems, well-established community health units, will tend to do better than counties which are still at infancy stage in development of community health strategy. So that challenge will be there, but not to downplay the advantages that accrue from home-based care. As at now, we have discharged more than 5,666 people from home-based care. So if you look at our cases, almost 50% are from home-based care and 50% from institutional care. But remember, we only started home-based care about 6-7 weeks ago. Today is day 144 since we had the first case of COVID-19. So we are reaping good dividends from home-based care, and despite the challenges, we'll soldier on to be able to strengthen our systems. The other question was on healthcare workers infected. Of course, healthcare workers are the front line and therefore would be exposed to getting COVID-19 disease. And that is why we have repurposed to ensure that we have personal protective equipment. We have done capacity building. We have done training on infection prevention control, and we continue to resensitize them. But also healthcare workers are also part of the community. It does not mean that if you are a doctor, you can only get infected in this facility. If you go outside this facility and you don't take the necessary precautionary measures, then you could also get infected outside your place of work. As of today, we have 723 healthcare workers, 385 of them who are males and 338 females who have been infected by COVID-19 disease. That is about 3% of the total caseload. The global average is about 10%, so we are still doing relatively well, but we are not going to rest on our laurels because our caseload is 3%. One healthcare worker infected is already one too many, and we will continue to ensure availability of PPEs, proper capacity building, infection prevention control measures to shield the healthcare workers, because they are our last arsenal in the fight against this pandemic. Unfortunately, when people get infected, some people also get a very serious form of the disease, and of course the healthcare workers, as at yesterday, 8 of them had passed on, and today you have reported another 2. That brings us to 10 healthcare workers. Again, our sincere condolences to the families and relatives of those who have left gallantly fighting this pandemic. There was the question of retesting. Yes, now we are using the new WHO CDC guidelines. We don't need to retest you if 10 days after your symptomatology, you don't have any fever and you are not using any fever-reducing medicines for the next 3 days. So after that, 10 days plus 3 days, without any symptoms, no fever, you don't need a retest. Because studies have shown that even if you retest you after 20, 30 days, you could still be positive. But you are shedding a virus that is not infectious. So wasting a very scarce resource that has posed a challenge to our country. Thank you, Waziri.
Thank you all very much. Asanteni sana.